Why don't you tell me a little bit about why you're here today?
Well, I came to you recommended by another doctor. I have had chronic headaches for 20 years, and I've taken different medicines, and they work for a while, but now I take double a dose of headache medicine prescription, and it still doesn't wipe the headache out. I've gone to a lot of doctors because I have horrible headaches, and I've tried different things from scans of my neck to scans of my nose and MRIs and brain scans, and no one can find out really what's causing it. I've tried a lot of different medicine, and I still continue to get them. One doctor sent me for a scan, and there was like
Scan of your neck?
Yeah, there's a little slip disc, and he was sure that was it. But then I went to someone else, and they thought no. So I'm just getting kind of frantic as to why I'm getting these headaches and what to do.
And tell me about the headaches.
Well, they usually come on in the afternoon, and it does sort of start in the back of my head and then just takes over. And sometimes after I've been in like if I travel and have a big presentation meeting, the next morning, I mean, I literally can't get out of bed. I'm in so much pain. So I would guess that maybe some of it is brought on by stress, but it's always after the fact rather than during it. I always thought somehow that stress did add a lot to this. And then, of course, the stress of having doctor bills, more medicine bills, because I took a lot of medicine that different doctors prescribed for me.
Right. And it's still not working.
But it's still not working. I can sort of feel it start to work, but then, and I've heard of rebound headaches, so I'm sure by taking the medicine every day, I'm making it go on, but I don't know what else to do.
And how often are you getting the headaches?
Almost every day, and sometimes on the weekend they'll come at a different time. During the work week when I'm at my desk, it's almost every day between 2:30 and 4.
You've had an MRI of your neck
Yes.
and also of your brain because you spoke to...
Yes, several times.
Yeah. And right now you're on a bunch of different medications. You're on medication for pain, you're on medication to sleep, you're on medication to try to relax, and you're on a bunch of medications to help you with your headache. So quite a bunch of medications, and you're still really suffering from the headaches.
Right.
Yeah. Okay, and then right, I'm going to examine you now. So when Susan came in, there were multiple different causes for what could be her headaches. She could have had the headaches because of her neck issue, that she had complained of with a disc there. She could have had it just from tension and stress. She could have had it because of migraines, or she could have had it from something horrible like a brain tumor or some other neurologic problem. So the purpose of the exam, the neurologic exam, is really to do exactly that. We look at the person's eyes to make sure there's nothing there within the cranial nerves or all the nerves that supply the face, the muscles of the face, the visual apparatus, hearing, the muscles of mastication. Make sure it's not temporomandibular joint disease. Close your eyes as tight as you can, like you have soap in your eyes. Perfect. Open your eyes and puff your cheeks out. Don't let me push them in. Relax. Push your tongue over this way, and now over this way. Bend your chin down. Okay. Shrug your shoulders. I also checked to make sure that it wasn't from a disc in her neck, and that would be showing up on the exam. So from the exam, it was very clear that she didn't have a brain tumor, she didn't have strokes, she didn't have the neck problem as a cause of her headache, and it appeared that it was primarily a combination of migraines plus stress that was causing her headache, and therefore I was able to target my treatment to treating that particular etiology. So this is what I think. I think that my sense from looking at you is that I don't think that this neck problem is the reason for your headaches. I think the neck may be exacerbating or making it worse, but I really think that the headache needs to be addressed first, and probably taking all these medications, you know, is as you say, causing a vicious cycle of sorts. So what I'd like to do is, if you agree, we'll try to taper you off your medications very slowly, and have you on the right dose of the right medication of just any one pill that's actually effective. How do you think that sounds?
I think good.
Yeah.
You know, you sort of depend on medicine, so, but I'll try anything.
And then I'll see you back in a couple of weeks to see how you're doing. How does that sound?
Good, good.
Okay.
I'll try anything.